Hi everyone. Today's topic is on two rotator cuff strengthening exercises that are very commonly prescribed by many people for people with shoulder pain. So we're going to do banded internal rotation and external rotation, and what I'm going to talk you through is the best way to do these with proper technique. Now these exercises are probably not the best rotator cuff strengthening exercises, but they're a good way to start if you have a sore shoulder. And like I said, it's something that I start patients with. It's good to do if your shoulder is really painful. It doesn't challenge it a lot, but it does get some of the rotator cuff muscles working the way we want them to. So the bands that you use, it doesn't really matter. We're just going to use bands with handles here. It could be thin bands, it could be tube bands, but the setup and the direction that you're pulling is the important part. So the first one we're going to do is banded external rotation. So think of external as exiting away from your stomach or pulling out, okay? So with Josh's setup, and when you do this at home, you want your elbow against your side and the angle of your elbow at 90 degrees. That angle should not change at all when you do this exercise. So if you find that when you pull out your elbow is straightening or that it's bending, you're not doing it right, okay? So we try to keep this at 90 degrees. I have the band set up at the attachment point a little bit lower than Josh's hand because I'm gonna have him angle up and out a little bit with his rotation. So standing up tall, Josh is gonna start with his hand across his belly, and he's gonna pull up and out a little bit with his hand while keeping his elbow against his side, and then back down slowly. So a slow pull out, pause, slight pause there, and a slow pull in. So think down and in a little bit, up and out a little bit, keeping the angle of the elbow at 90, and that'll work the backside of your rotator cuff muscles, okay? Now the other one group of muscles that we want to watch do the opposite direction, or that we want to work do the opposite direction. So one is external rotation, the other is pulling in. So if we wanted to do pulling in, that's called internal rotation. I'm going to switch the bands up here a little bit. This one is usually stronger, and I have it attached a little higher than Josh's hand. So now the resistance is from the other direction, so Josh is going to start with his hand out, and now he's going to pull kind of down and in towards his stomach. Slow in, pause at the middle, slow out, down and in. And again, the elbow angle does not, at 90 degrees, does not change. So that's the basic technique for shoulder internal and external rotation. If you have pain with any of those motions, you need to talk with me or your therapist and make some adjustments. Some adjustments would be decreasing the range of motion. So instead of going out all the way, we would stop here and pull in. If it hurts when you're by your belly, then you could stop short of that and start here, but find a range of motion where you have minimal discomfort. A little bit is okay, but a lot is not okay. So there's a banded shoulder internal and external rotation done with a proper technique. Give it a try. Like I said, there's many other rotator cuff strengthening exercises that might be better, but that's a nice one to start with, and give it a try. So reach out if you have any questions. I'd be happy to talk with you. Thanks.